A foodborne illness is a disease transmitted to people through food. An illness is considered an outbreak when two or more people have the same symptoms after eating the same food. An investigation is conducted by state and local regulatory authorities, and the outbreak is confirmed by a laboratory analysis. Food service operations work hard to minimize foodborne illness. As a result of these efforts, foodborne illnesses have declined in recent years. However, operations still face many challenges to food safety. Pressure to work quickly can make it hard to take the time to follow food safety practices. Your staff may speak a variety of different languages than you, which can make it difficult to communicate. Cultural differences can also influence how food handlers view food safety. Staff often have different levels of education, which can make it more challenging to teach them basic food safety skills. Illness-causing microorganisms are more frequently found on food that once was considered safe. Food that is received from suppliers that are not practicing food safety can cause foodborne illness outbreaks. The number of customers at high risk for getting foodborne illnesses is increasing. An example of this is the growing elderly population. Training new staff leaves less time for food safety training. The ServSafe program will provide tools needed to overcome the challenges in managing a good food safety program. Foodborne illnesses cost the United States billions of dollars each year. The National Restaurant Association figures show that one foodborne illness outbreak can cost an operation thousands of dollars. It can even result in closure. Some business costs were highlighted in the video, but there are also human costs, which are identified on the slide, such as lost work, medical costs, long-term disability, or even death. Unsafe food is usually the result of contamination. Contamination is defined as the presence of harmful substances in food. To prevent foodborne illnesses, you must recognize the contaminants that can make food unsafe. These can come from pathogens, chemicals, or physical objects. They might also come from certain unsafe practices in your operation. Note, these will be discussed in depth in Chapter 2. Purchasing food from unsafe sources is a risk factor for foodborne illness. Keep in mind that food prepared in a private home is considered to be from an unsafe source and must be avoided. The other risk factors for foodborne illness are related to four main practices: time temperature abuse, cross-contamination, poor personal hygiene, and poor cleaning and sanitizing practices. Pathogens can be spread to food if equipment has not been cleaned and sanitized correctly between uses. This can happen in the ways included on the slide. The list of TCS foods includes the following: milk and dairy products, shell eggs, except those treated to eliminate non-typhoidal salmonella, meat, which includes beef, pork, and lamb, poultry, fish, shellfish, and crustaceans. This also includes baked potatoes, heat-treated plant foods such as cooked rice, beans, and vegetables, tofu or other soy protein, synthetic ingredients such as textured soy protein in meat alternatives, and sprout seeds. Also sliced melons, cut tomatoes, and cut leafy greens, and untreated garlic and oil mixtures. The immune system is the body's defense against illness. Elderly people are at high risk because their immune systems have weakened with age. Very young children are at high risk because they have not built up strong immune systems. And certain medical conditions and medications can weaken a person's immune system. These include cancer or chemotherapy treatments, HIV or AIDS, and transplant patients who take immunosuppressant medications. Set up standard operating procedures that focus on these areas. The ServSafe program will show you how to design these procedures. As a manager, your job is more than just understanding food safety practices and creating the necessary procedures. You must also train your staff to follow these procedures. Staff should be trained when they are first hired and on an ongoing basis. Your entire staff needs general food safety knowledge. Other knowledge will be specific to the tasks performed on the job. For example, everyone needs to know the correct way to wash their hands. However, only the receiving staff need to know how to inspect produce during receiving. Staff need to be retrained in food safety regularly. When a food handler completes this training, document it. Again, it is important to document when a food handler completes food safety training. Once staff are trained, monitor them to make sure they are following procedures. At times, you may notice employees doing tasks incorrectly. Each incorrect task could lead to an increase in risk. When this happens, it is important to correct the situation immediately. This is called corrective action. If an employee often completes a task incorrectly, or if multiple employees complete a task incorrectly, they should be retrained. Staff are not the only ones who need training to keep food safe. The FDA Food Code requires the person in charge of a food service operation to become a certified food protection manager, and they must be on site at all times during operating hours. For some types of operations, the person in charge may not need to be on site at all times. That is the case if the regulatory authority has decided that the operation poses a minimal risk for causing a foodborne illness. That decision would be based on the kind of operation it is and the type of food that is served or sold. Cashierless markets and convenience stores are good examples of operations where the person in charge may not need to be on site at all times. The person in charge must also be able to show that they have the required knowledge. To become a certified food protection manager, you must pass a test from an accredited program. The program must be accredited by an agency approved by a conference for food protection. Completing the ServSafe Manager course and passing the ServSafe Food Protection Manager Certification Examination meets this requirement. But why is it so important to become certified? A CDC study suggested that the presence of a certified food protection manager reduces the risk of a foodborne illness outbreak for an establishment. The study also suggests that it was a distinguishing factor between restaurants that experienced a foodborne illness outbreak and those who had not. Also, the FDA's retail food risk factor studies suggest that the presence of a certified food protection manager has a positive correlation with more effective control of certain risk factors, such as poor personal hygiene in different facility types. These are important agencies to remember for the test. The FDA issues a food code. This science-based code provides recommendations for food safety regulations. The food code was created for city, county, state, and tribal agencies. These agencies regulate food service for the following groups: restaurants and retail food stores, vending operations, schools and daycare centers, hospitals, and nursing homes. Although the FDA recommends that states adopt the food code, it cannot require it. Then we have the U.S. Department of Agriculture, also known as the USDA. It regulates and inspects meat, poultry, and eggs, and regulates the food transported across state lines, and regulates food involving more than one state. The Center for Disease Control and Prevention, also known as the CDC, and the Public Health Service, PHS, assist the FDA, USDA, and state and local health departments. They also conduct research into causes of foodborne illness outbreaks and assist in investigating outbreaks. Codes may differ from the FDA food code because these agencies are not required to adopt it. That concludes Chapter 1. Please use your ServSafe Food Manager book to go and apply your knowledge with the concepts presented on the slide.